At Intermountain Healthcare, the Sigma Spectrum Infusion System wireless capabilities are now an integral part of the daily clinical workflow. The workflow process begins when a physician enters a medication order. The pharmacist then checks the order and routes it for dispensing. A clinician will access the patient's information and any relevant IV orders in the EMR. Medication delivery for that patient then begins with the clinician scanning the barcodes on the patient's ID and the IV bag. Scanning the pump barcode at the bedside establishes a positive patient ID and links the pump information to a specific patient IV order. The barcode label on the pump is unique to Intermountain Healthcare's EMR system. The EMR automatically creates certain associations based on the barcoded information that is sent through the system. This is how the clinician establishes the 5 rights of medication administration. The Intermountain EMR then sends the appropriate IV order information to the Sigma Gateway server, which in turn wirelessly transmits the order to the patient's pump. The IV order information scrolls across the top of the pump display, and the clinician then programs the pump, checking to make sure the pump program matches the order from the EMR. After the infusion is started, the Sigma Spectrum pump sends status updates wirelessly to the Sigma Gateway server. The Sigma Gateway server receives pump and infusion data and transmits it to the EMR. The EMR automatically documents the infusion within the nurse flow sheet for that specific patient and IV order. In addition to the documentation workflow, the EMR processes the pump and infusion data through a rules engine, which generates specific alerts and alarms that are sent to clinician workstations in the appropriate care area. Pump and infusion data are aggregated in the Sigma Gateway server to provide continuous quality improvement, or CQI data, to help optimize the master drug library configuration and provide analysis to improve clinical practice.
So the advantage of having all the data get ordered from the pharmacy into the EMR, we know what that order is. So when a nurse goes and connects that drug to that pump or hangs that drug to the pump, that drug has to match what the actual order was.
Having the capability of the DIA, the wireless system, interacting with the EMR has improved the nurse workflow by decreasing the repetition of documentation, as well as streamlining so that we are able to accurately have correct infusion histories so that physicians can use that for the care of the patient.
We have a bunch of different processes that we've written that are all monitoring one another and shifting data to and fro to the correct places. So if you look at the big picture, there's a lot of things going on, but we've tried to make it as simple as possible for everyone to work with it. Because really the ultimate goal is to make lives easier for clinicians and keep patients safe.